Hi, my name is Calvin Neufeld. I am a trans man, and I describe myself as a speaker, writer, and thinker. It's what I do. I go into schools, colleges, universities, community groups, churches. I do education around sexual and gender diversity. I speak about bullying, mental health issues, suicide, all kinds of topics that touch quality of life, and all with the goal of trying to make life better, trying to make life good for me and for everybody else. I'm also an editor and a publisher. My mother, Francine Neufeld, is the author of the book Suffering Eyes, A Chronicle of Awakening, which is about her awakening to the suffering of animals at the hands of humans. We distribute the book. I published it, and we distribute it through farmed animal sanctuaries exclusively. So they sell the book, they keep all proceeds, so that all proceeds from the book support rescue. And so I suppose you could also describe me as an animal activist. Much of my writing and articles are around that. I'm also wearing a Toronto Pig Save hoodie here. I was just speaking at a fundraiser for them just a few months ago. Last summer I was speaking in Washington, D.C. at the Animal Rights National Conference. I'm vegan, and much of my work really is not just about quality of life for me and for other human beings, but for animals as well. I've also I've connected the issues because all oppression intersects. And I've written calling for a trans-vegan alliance in the same way that others have called for, say, a feminist vegetarian alliance like Carol J. Adams. And I believe that for trans people who are kind of somewhere around the bottom of the ladder of human hierarchy, how can we hope to lift the weight of oppression from our shoulders while we continue to engage in the oppression of others who are considered to be beneath us, namely animals? So I believe that we cannot end oppression until we ourselves refuse to participate in the oppression of any other. So for those reasons, I've written and called for a trans-vegan alliance, because if I were to deconstruct that ladder of hierarchy, I wouldn't begin at the top. I begin right down there at this bottom, or the second to last bottom rung, and encourage those folks to be the first ones to step off of that ladder entirely by refusing to step on anyone beneath them. So I'm all over the map in terms of what I do, what my interests are, my hobbies. I play piano. I love music. I garden. I'm an avid gardener. I'm always itching to get out into the gardens and plant the seeds and transplant my plants, vegetables. I love to grow food. So that's a lot of fun, and I'm also a full-time daddy now. My wife and I adopted a beautiful one-year-old boy 2 years ago, so he's now 3 years old. We love him to death. We're very, very happy as parents. And that fills up a lot of my time, and it gives me a garden helper. I also volunteer on a couple of local farms. And lots of different things, interests and activities and hobbies. I do crafts. I make children's toys, stuffed toys, quilts, all kinds of stuff. I don't know. I just like to have fun. Let's see. How did I come to understand that I was not the gender I was assigned at birth? Well, when I was really young growing up, I didn't really understand myself as being particularly different. I dressed how I wanted. My parents let me dress how I wanted, so I dressed more or less like a boy. And I played with the friends that I wanted to play with, who were all boys. We played G.I. Joe and mucked around with the leaves in the ditches, and by night we were ninjas, and by day we were Ninja Turtles, and that was my life, and I was really oblivious to any sense of being in any way different. I was just me. And it's a bit surprising that I was allowed to dress how I wanted and play with whoever I wanted, because I was raised in a very conservative evangelical Christian home. but my parents were, I guess you could describe them as free thinkers, and if their daughter wanted to dress like a boy and play baseball and kick butt, they were proud of me. And my mom just saw this as one of the many ways in which a female is free to express herself. So I really didn't feel the weight of being different for a long time, until puberty. And once my body began turning female for real, and once people began to see me as female for real, that's when I really began to feel the weight of it. And they describe it as gender dysphoria, and that's exactly how I experienced it. Puberty felt like a betrayal. My body felt wrong. Everything that was happening to it felt unnatural. And I began to hate my body. I began to hate myself. And I entered into a very long period of depression in my life. Many, many years. And not just depression, but that escalated into self-harm, extreme self-harm, self-mutilation, anorexia, and then bulimia for many, many years. My body had become an enemy to me. So it was a very difficult adolescence for me to navigate. And I was confused. I had no way of understanding why I felt the way that I felt. Why my body didn't feel right. Why I didn't feel particularly belonging among girls. I'd never met a trans person. I had no point of reference, nothing to compare myself to, no knowledge that this exists. So what was it? How did I come to understand my gender? The answer being, very simply, meeting a trans person in my early 20s. For the first time, I met a trans man, and that was it. I saw myself in him. And with that, I understood myself. It was a sort of an oh shit moment, I guess you could say. Realizing, oh, that's me. That explains it. I'm trans. Nobody wants to be trans. But understanding myself, oh, the doors that opened for me. It was like the heavens opening in the Alleluia chorus. And just seeing him, and he hadn't even had any surgeries. It was just through hormones. And he looked and sounded like a guy. And I couldn't believe it, that this is possible. This is possible. That this exists. So understanding myself, and from there on, I knew what the next steps for me would be. It was still hard. I was still afraid to talk about it, to come out about it. But that's what sort of opened that door for me, was simply meeting another trans person and learning that this exists and that this is possible for me. Was there anyone who was particularly helpful for me? Well, that trans man certainly was, meeting him. How that changed my life, and he ended up being my best man at my wedding. I still hadn't transitioned at the time, but I wanted somebody standing up there next to me who understood me and who knew me. So that was special. Also, my wife Sharon has certainly been an important person in my journey. When we first met, I was female and Christian and closeted. And, I confided to her that I was gay, or that I was attracted to women, and that as a Christian, and, I believed that this was a sin. And I told her that I was closeted. I hadn't told anybody about it. And she couldn't understand. She couldn't relate. She was raised without any religious beliefs whatsoever. And to her, this was such a foreign concept, to have any problem with homosexuality. She told me her response was that, she always knew that there were people out there who were homophobic, but she never thought she would actually meet one. It's kind of like with racism. Everybody understands that there are people out there who are racist, but you don't necessarily expect to meet one, let alone one who will just come out and say, I'm a racist. I think the other races are inferior, or whatever it may be. And here I was saying that homosexuality is a sin and not even thinking about what it was that I was saying. So her response to that really made me think. And from there forward, it was we loved each other right away. She loved me for who I was. And she just gave me a safe space in which to take my own steps to becoming myself. It began with the little things. You know, I would complain to her about having to shave my legs all the time. I hated it. And I would complain every time, I hate doing this, I don't want to do it. And she would say, well, then don't do it. If it's making you miserable, don't do it. I hadn't thought of that before. So that was new to me. And I stopped shaving my legs. Simple as that. I would complain about hating having to do my hair every day. I'd try to figure out what to do with it. And I would always just end up pulling it back into a tight ponytail. Just get it out of the way. I don't want to think about it anymore. And I would complain, telling her I'd always just wanted to shave my head. And ironic that I turned out bald, but so she said, so shave your head, cut it all off, and got out a pair of scissors and she cut off all my hair, and that was that. You know, it was for her so simple. For me, it was equally simple, but I didn't realize that at the time. Also complaining about getting dressed, having to put on women's clothes every day. It made me feel sick every day getting dressed, and I communicated this to her, and her response was, all right, well, let's go shopping. And so we went out, and she let me buy whatever clothes I wanted, men's clothes. She didn't ask questions. You know, it was just simply creating a safe space for me to take my own steps at my own pace. What were my choices to facilitate my transition? What were my choices? To facilitate my transition. It wasn't a choice. There was no choice for me. Once I understood that transsexuality exists, and once I recognized myself in it, I had no choice. And ultimately what it came down to for me was that I was desperately unhappy. And I figured from that point, if there's a chance that this will bring me some happiness, I have to try it, because I can't go on anymore. I didn't know for certain, nobody knows for certain that this is going to solve, and nothing will solve everything. There's no magic cure for all of the troubles in life, but if there was a chance that this would make living a little better for me, what did I have to lose at that point? So I decided, let's do it. Let's just do it. Whatever it takes, however embarrassing, however scary, however difficult the journey might be, it was better than the way things were. So I knew I couldn't go on the way things were, and that left me only one choice, really. And I'm not sure that one choice is a choice. Other choices. Well, let's see. From a different perspective, another choice that I made around my transition to facilitate it was to quit my job. Which, looking back, I do regret. At the very least, I could have sat down with my employer and had a conversation about what I was intending to do, and maybe asked for an arrangement that I would be laid off instead of to quit, and then I could have still had employment insurance, or to take a medical leave of absence. There are actually a number of options, but the embarrassment that I felt about this, I just wanted to sort of disappear. And I don't think that that's healthy. It doesn't feel right that a trans person should have to disappear to go through a medical process. Any other medical process that a person undergoes, if they can still work, then why can't they still work through it? But the fear of going through that, among still seeing my coworkers and under that microscope and people who may or may not understand or may not approve, And it's a shame that that's a situation that trans people often face. And so through my transition, I lost my income, lost my insurance. And that was unfortunate. And the connections and the friendships and the, employment history. A lot of that just stops and gets erased. And then re-entering the workforce after transitioning was also a challenge. Putting references, the old references that my employer might contact might not know who Calvin is. They employed Caitlin. It's a challenging process to navigate. Another choice that I made to facilitate my transition was to have begun my transition before coming out about it generally. My wife knew. She always kind of knew. At some point I began to actually use the word transsexual, which was still very hard for me at the time. But she knew, she understood. She just wanted me to be happy. She just wanted me to not be miserable. So for her it was really quite easy. But for the rest of my family and friends and everybody else, I waited until I had begun my transition. Until after my first hormone, therapy had begun. Because I didn't want to tell them what I was intending to do. I wanted to tell them what I was doing. I wasn't looking for their permission. I was simply informing them. And I think that did help. It sort of lifted any sense that they might have of needing to give me their opinion or their advice or to raise their concerns. It was not something that was going to happen. It was something that was happening. Something simply to accept. And maybe in some small way that helped. Shifting to talking about healthcare, can you tell me about your best or worst interaction with a healthcare provider? Let's see, best and worst interactions with healthcare providers. I have to say that overall, my experiences with healthcare providers have been overwhelmingly positive. I don't know if I'm just lucky or privileged or I don't know what, but I just have so many good experiences with healthcare providers. So one story that comes to mind, a year or two ago, I had to have an appendectomy. And that came it came about kind of suddenly, over a couple of days, the pain in the side getting worse, and finally going in to have it checked out by a doctor at emergency, and getting poked and prodded and getting asked questions like, do you have pain in your testicles? And I had to say, no, I don't know. Do I tell them? Do I explain? I don't know. But little fun things like that, and then getting shipped off to another hospital to have the procedure, all of it happening very quickly, and then getting prepped for surgery, and all of a sudden it occurs to me that in a matter of moments, I'm going to be in that operating room, essentially naked, with all these people around, and that's going to be awkward. I hadn't even thought about it. I hadn't even thought about it until that moment. And then the surgeon comes out and asks me questions. He's flipping through my file and asks me, have I had surgeries before? Have I had laparoscopic surgeries? And I had to tell him, well, it's kind of a funny story, but, I had a hysterectomy, a laparoscopic hysterectomy. And just seeing the expression on his face, it wasn't a bad expression. It was just surprise. He was like, whoa, I can't believe that. That's crazy. He said, you must have had a ton of funny conversations so far today, haven't you? It was just funny. It was a lighthearted moment, and he just said, it's nothing, no problem. It was just nothing. That's it. It was nothing. And I loved that it was nothing. As it should be. So that was one of the, best moments, I guess. It's just it being nothing. What else? Well, my hysterectomy also was a very positive experience. And again, that was one of those situations where, I was referred to this doctor, a gynecologist in Kitchener, Waterloo, who does hysterectomies on trans men. And going into her office for the first consultation, it occurred to me as I walked in, this was my first and only and last time ever in a gynecologist's office. I'd never been to see a gynecologist before or since. And walking in there, it occurred to me very suddenly that, wait a minute, this is a place where only women would go. I hadn't thought about that before. And walking in, I, was already on the hormones, and I already looked and sounded like a guy. And sure enough, there were women in the waiting room, and I got a couple of quizzical looks, I suppose. But I went up to the receptionist. I told her who I was. I'm here to see Dr. So-and-so. She said, "Oh, right, no problem. Have a seat. She'll come out and see you in a moment." Then when I finally went to go and see the doctor, she sits down and says to me, "All right, well, when a guy comes in for a hysterectomy, this is what he can expect." And I was just kind of, when a guy comes in for a hysterectomy, simple as that, it was nothing. That was another one of the good moments. Let's see, worst interactions with healthcare providers. It's unfortunate, but I would have to say that my worst experience with a healthcare provider has been with the Center for Addiction and Mental Health, the Gender Identity Clinic at CAMH, which is a real shame because they're virtually the gateway to trans health care, and that is one of the few negative experiences with healthcare that I have ever had. That should not be the case. And I never went to the clinic. I applied to the clinic. I received the application form. And just reading the application form made me feel violated and very uncomfortable. I couldn't fill it out. I couldn't answer their questions, and I certainly couldn't answer questions like that for people who I didn't trust to have my best interests in mind. One of the questions was to describe the size, shape, and function of my genitals. Why in the world should I have to tell you that? Or requiring me to give detailed information about every member of my family, including their home addresses, dates of birth, their spouses, dates of birth, all kinds of information about people who I don't understand why you're gathering that data. There was no explanation for why they were gathering any of the data that they were gathering, which to me seemed like private research, not research that's directly related to administering basic trans health care. So I was very skeptical and very uncomfortable, and I couldn't answer half of the questions. Some of them were, how often do you cross-dress? Do you cross-dress at home, outside of the home, at work? When, how often? I don't know. I wear pants. Is that cross-dressing? Do I do it just at home? Do I do it outside too? I had to picture myself, essentially, to answer the questions, I had to picture myself as a cross-dressing man in order to answer those questions. And that's not a trans man, and that's not a trans woman. So I think that the questionnaire revealed a very antiquated way of thinking around transsexuality. And I could only see it applying to trans women if trans women are perceived as ultimately cross-dressing men. That's the only way I could see any of those questions really making sense. So they didn't make sense. And it's a shame because I would have liked to have gone and had my surgeries funded. I paid for my top surgery myself. And I simply didn't pursue lower surgery, which I think I would have if I could have accessed that health care in a way that preserved my dignity. And other trans people that I've spoken to, I would say all but one that have gone through the Gender Identity Clinic at CAMH have reported coming out with more mental health issues and with lower self-esteem than they had when they went in. My experience with my endocrinologist was mixed, good and bad. So when I was first looking for an endocrinologist, I was living in Kingston, Ontario at the time. And I called around. There were 3 endocrinologists in town. I called the first one. I never got through. I called the second one. They told me outright that they don't treat trans patients. They told me directly that they reserve their services for people for whom it's a medical necessity. And I called the third one. They did treat trans patients, and I went in. And he was a very nice older man. But, I think that even he could have benefited from some further education around transness. He used a lot of outdated terms. He also referred to CAMH as the Clark Institute, even though it hasn't been referred to as the Clark for many, many years. So I think he was one of the older mindsets as well, but he was nonetheless respectful, and I got my prescription, and that's what I ultimately wanted, so I was delighted. There wasn't really any follow-up. I wouldn't say that my hormone levels were being monitored by my endocrinologist. So I would say that ultimately what I got through that was a health service, which was the prescription, but actually receiving health care as it relates to hormone therapy, I don't know what that would look like, because I don't think that I actually received that. My family doctor is very supportive and understanding. In fact, I got her because she heard about me. She wasn't taking on new clients, but she heard from one of her clients that I was looking for a doctor and that I was a trans person. And she said, she's always wanted to learn about transsexuality and was eager to take me on as a client out of interest. And she's a fantastic doctor. So in a sense, I got priority treatment on the basis of being trans. So that was nice. Pharmacists have always been perfectly respectful. When I moved to a new town, I thought, this is a small town. I live in Perth, Ontario now, and I wonder when I bring this prescription into the pharmacy here, will they sort of wonder why I am on, male hormones? I'm out as a trans person, but I don't broadcast it. I'm visible. I have a website, calvinneufeld.com. I give talks locally and all around town, but I never know who knows what about me, and if they find out, will that be a problem? I never know. It really never is, to be honest. Social workers, I don't have a lot of experience with social workers as a client. I do have experience with social workers in the talks that I give. I've gone to many a class at Algonquin College or St. Lawrence College, to social workers, social service workers. And I always love it. It's always a positive experience. The students are always very respectful, eager to learn, curious, and it's always a positive experience. Always they have an intention that when they go out into the workplace that they want to be able to meet the needs of their clients. I also, I guess, through the adoption process, have some experience with social workers in that context. And they were very respectful. My adoption workers, they said, they've never met a trans person before that they knew of. They've never had a client who was trans. They had placed children with families of lesbian and gay parents, and that was always a very positive experience. They were very open and understanding of diversity, but they didn't know much about transsexuality. And it was sort of an interesting conversation for them to say, okay, well, what do we need to know about it? I don't know. What do you need to know about it? I couldn't really think of anything as it relates to my potential as a parent. But, we just navigated our way through it together, and they learned as they went along, and in the end, they deemed us worthy to be parents, and we have a beautiful boy. What barriers do you see in the healthcare system? What barriers do I see in the healthcare system? Well, there are many, aren't there? The barriers that I see in the healthcare system, for one thing, nobody knows how to navigate it. When it comes to trans healthcare, even though we've made tremendous progress in the last few years, Sherborne Health Centre is doing tremendous work. CAMH is being decentralized. It's no longer the exclusive gateway to approval for surgery. But still nobody really knows how to go about accessing trans healthcare. I get emails all the time from trans people saying, well, so how do I get a referral to an endocrinologist? How do I get my surgery funded? Where will my surgery be done? Who do I have to see? Can my doctor refer me? So still, we don't know. And people are coming to me, doctors are coming to me on behalf of their clients. To me. Nobody. Just a trans person who happens to be publicly visible. And healthcare practitioners are contacting me to ask how they will go about helping their clients. So that's a barrier. It should not be such a blind maze. In one article, I've described my experience with the healthcare system being having to machete my way through the neglected undergrowth of transsexual healthcare in Canada. So that is certainly a barrier. I think that one of the biggest barriers to accessing trans healthcare has to be social attitudes towards transsexuality. And not because they present a barrier in and of themselves, but because they result in lower self-esteem and lack of confidence in trans people to come out and brave a transition. I worry that a majority of trans people may actually not be out. The people who are afraid to come out as a trans person and pursue a transition have to outnumber the people who are brave enough to do it. So I believe that social attitudes that keep people in the closet are the greatest barrier to trans health care. And you know, it's bullying, isn't it? I do talks on bullying, and after one talk, a woman wrote to me who's a mother of a trans person. And she wrote that she realized, after listening to my talk, she realized that she was being bullied by her family. Her family refused to call her child by that child's chosen name and refused to use the appropriate pronouns and discouraged the mother from talking openly about her child being trans. And she realized, I'm being bullied by my family. And being able to name it and recognize it empowered her to begin to change that. And that's what happens with our social attitudes and social pressures. It bullies us into submission, bullies us into silence, and bullies us into staying in the closet. There's been a lot of controversy around timing, the speed of the system, and waiting for next steps. How do you feel about that? The controversy around timing, the speed of the system. How do I feel about that? Not good. It makes me furious. The time that's wasted is time that costs lives. The thing is, when you're a trans person and you finally come to recognize and accept yourself as trans and finally come to have the courage to come out and say, I'm trans and I'm going to transition, and then to find that you're up against a wall and that it could be years before you can access your transition. Being in that limbo, it's a dangerous place. And it's even more harmful, I think, than if that person had stayed in the closet. To come out, to have that courage, and to not be able to take your next steps. You see, when it's very hard for people to understand transsexuality. So you have to picture it. Picture me as a girl and saying and looking like a girl and sounding like a girl and saying to you, I'm a guy. That's really hard for somebody else to understand or accept. But once I look the way I look and sound the way I sound, it makes sense. And people can come to an understanding of just how and why it actually makes sense. And that's what I find with people who knew me before. who maybe didn't understand or accept it right away, and they meet me now and say, okay, yeah, I can kind of see it, I kind of get it, and you're still you. I get it now. So when a person finally has the courage to come out, speak their truth, the transition really can't happen fast enough. And not just for their own mental health, and not just that they can move on with their life and with themselves, but so that their family and friends and coworkers can also come to an understanding that much more quickly. Being stuck in that limbo is the worst place to be. Waiting has been linked to increased incidence of depression and mental health problems. Do you have any thoughts on this? Well, of course, waiting is linked to depression and mental health issues. You can't get on with your life. And worse, you can't even see yourself as yourself. Other people can't see you as you. You're stuck in that particular hell. And there's no reason for it. I don't understand why there's this sense that, well, you have to practice for a while being a woman, or practice being a man, or ease your way into it. That doesn't make sense. I'm a man. I don't need to practice it. And I certainly don't need somebody to tell me how a man walks versus how a woman walks, But waiting, and what the waiting communicates in the meantime, the way people treat you, unfortunately, depends largely on your appearance. I hate that that's the case, but that's the case. And when we force trans people to get stuck in between, we're putting them in a very risky situation, risky for their personal safety, their physical safety, and of course for their mental health. They're being denied seeing themselves the way that they truly feel. Others are being denied being able to see them as they truly are. Oh dear, what are my thoughts on this? And what does the waiting ultimately communicate anyways? That your medical needs are not important. For me, the barriers and the delays in accessing trans health care are symptomatic of a deeper problem, that the healthcare system still doesn't fully recognize this as a medical necessity. And it's a shame, because the suicide rate of trans people is devastating. And trans people like me who have had access to healthcare that's appropriate to our needs, the suicide rate drops enormously. One statistic I heard is that the suicide rate of trans people is as high as 1 in 5, but that for treated transsexuals like me, the suicide rate drops to approximately 1 in 100. And that's a massive difference. It's still not a great number. I'd like to see that 1 erased. 0 out of 100 will look a lot better. And once we create space in our society, and once we nurture a respectful healthcare system, I hope that we can simply treat this like we do any other medical condition and let people get on with their lives. What advice do you have for healthcare students? Advice for healthcare students. Well, I've met quite a number of healthcare students through my work, and my experience has been that, you're already in a good place. The students that I meet are respectful and open and eager to learn about diversity. It's that openness. That's what it all comes down to. The rest is just education, which you're receiving anyways. Beyond that, I think you already have the quality of heart and mind to be excellent healthcare practitioners. Well, let's see. If you are a healthcare practitioner and you're not trans or lesbian or gay or bisexual, they say to be careful, to be aware of your own misconceptions around these things, your own prejudice or bias, and to be aware not only of your attitudes and the kind of thinking that you have around sexual and gender diversity, but also your body language. If you're closed up like this and reserved, then that speaks more loudly than your words. So always be aware of what's going on internally and externally. And if you're a healthcare provider who is trans or lesbian, gay, or bisexual, be careful not to over-identify. Be careful not to think, well, I'm trans, so I get what your experience is, and I know what it's like, and I've been there. But every experience is unique. I would also encourage students to not be afraid to talk about these things or to ask a question. Especially when it comes to transsexuality or transness in general, any kind of transgender person. A lot of the time, people are reluctant to talk about these things because they're afraid of using the wrong terminology or an outdated expression or to reveal some ignorance. And so it doesn't get talked about. And I think that is much more damaging than the use of an outdated term. Not talking about it is more dangerous. So take the risk. And even if you do use the wrong term or something like that, or ask the wrong kind of question, which I don't know what the wrong kind of question is, but even if that happens and somebody corrects you, just thank them. And as a trans person, I know that these are not easy words to use or to become comfortable with. I mean, I had already begun the process of transitioning before I had really started using the word. And even then it still felt weird. The word transsexual. It sounds, I don't know, it sounds dirty. It sounds taboo. And now it's nothing at all. It is such a benign word to me, transsexual. So I would encourage students to become comfortable with talking about these things. Language is important. How can healthcare providers make their environments welcoming? What is not? Language is important. And I think that being able to use a word like transsexual, for example, language is important. And when we can't be comfortable using a word like transsexual in conversation, or that we think that this is only something to be brought up in behind closed doors, don't let anybody overhear, there's secrecy around it, we're giving language more power than it has. I don't like that language has become as powerful as it has. I don't trust that. Language is a tool. We created it for our own use. It's our tool. And instead it's turned around. And it's used against us. And it has power over us. And I don't think that that's its place. Pronouns, for example, can be quite powerful. Certainly there are plenty of trans people, including myself, who have experienced the use of pronouns as an act of violence, ultimately, when people refuse to use the appropriate pronoun. It becomes weaponized language. And that can be extremely hurtful to trans people when people intentionally use the pronoun of their birth sex instead of the pronoun of their felt gender. But then again, it's just a pronoun. If somebody calls me she, which these days does not happen very often at all, I don't care anymore. I am me. All I care about is that I recognize me in the mirror, and that when I hear my voice, it's not like fingernails on a blackboard to me. That's what matters to me. And I don't need you to recognize me. I don't need you to accept or acknowledge or understand me. It would be nice, but I don't need it. And ultimately, if somebody calls me she, you're the one who looks silly. But for many trans people, words remain extremely powerful. So certainly in a healthcare environment, it's important to be extraordinarily mindful of language. You know, sometimes people have asked me the question, well, sometimes I can't tell. Is this person a trans woman, or could this person just be a male cross-dresser? So do I use he or she? And that question doesn't make a lot of sense to me. If somebody is clearly presenting as a female, use she. And if they want to correct you, to say, no, even though I'm completely dressed up as a woman, call me he, then do that. But respect what somebody is clearly communicating about their gender. And if you're not sure, ask. Is just asking the best strategy? Yes. For me it is. Anybody you ask probably will give you a different answer, but for me, just ask. And break that ice. There have been times where I can tell that somebody, not recently, but mid-transition, there's somebody you can tell is wondering and wants to ask and is uncomfortable with that wondering, which makes me uncomfortable with their wondering, and I almost want to just say, just ask, I'd much rather have things out in the open. Bad things grow in the dark. How can healthcare providers make their environments more welcoming? Well, simple things like the rainbow sticker in the window or in a doorway. That's just a clear sign that this is a safe space for sexual and gender minorities. And people who are not sexual or gender minorities, they probably just don't even notice it, or just think, oh, hey, nice, a rainbow. But it is important, if you have the rainbow stickers in the window, to make sure that all of the staff in your environment have received proper training, because the last thing you want is to send out that message that this is a safe space, and to have somebody come in under that impression only to encounter the odd staff member who maybe will give them the evil eye, or be a bit confused or unaware how to respond to somebody who looks a little bit different. Also, on service intake forms, many of them just have 2 boxes, male or female. You have to check off one of those too, which for me at this point in life is not a problem. I'm legally male, and I feel like a guy, so it's pretty straightforward. But when I was in the middle of my transition, there were a number of times where I didn't know what to check off, because I feel like a guy, and I'm transitioning, and so I'm looking a bit like a guy, but my legal sex is still female. So I don't know what I'm supposed to answer, and there's no space given to explain. I heard a statistic in Ontario that 25% of lesbians and gays are not out to their doctor, that over 50% of bisexuals are not out to their doctor. And yet there was a study done where when the service intake form gave respondents an opportunity to self-identify, that 95% of respondents did. So to me, small changes can result in big changes. Language can certainly have a very positive impact. I think of when I hear somebody ask someone if they have a partner, instead of asking if they have a girlfriend or a boyfriend, for example, it's almost like a code word. Immediately I feel like I trust that person, that person is aware of the kind of diversity that exists. And, so words can be like code messages to say, I understand, I get it. But it can also be very harmful language. how it's been used. So take the word queer, for example. Historically, it's been used very abusively, very harmfully, but it's being cleaned up now. It's being remediated, especially by young people, because we have more and more terms and words and labels and identities, and it can be extremely distressing, especially for young people, to try to figure out what label fits me, what term fits me, what box do I fit in. So to be able to just say I'm queer, not otherwise defined, and I don't want to, it's freeing. And to self-define. Queer is the ultimate self-defined term. I know straight people who would call themselves queer. I'm a straight person and I can call myself queer. I'm heterosexual, but I'm certainly not the norm. Words and language are also really wrapped up with identity, which can be helpful for people to understand themselves, and it can be harmful in the sense that we can become dependent on an identity. And when that identity is lost, we lose our sense of who we are. I think that plenty of trans people have experienced a loss of identity and maybe struggle with adopting a new identity. You know, someone like me, I don't have an identity as a man. I don't know what it means to be a man. And I don't have an identity as a trans person either. I am a transsexual, by definition. But I don't form an identity around that. I'm a person of trans experience, that's all. I think that the risk comes when we lose some identity to replace it with another, then we become dependent on that other. And what happens if we lose that? I don't depend on people recognizing or affirming my identity of any kind. I don't have one. And that's okay. I'm me. And I try to be a good me and take care of my family and have good, loving relationships with people. That's all that matters. Not how I identify, not what label I carry, not what group I may or may not belong to. Someone who's Christian, if you lose your faith, then suddenly, well, what am I if I'm not a Christian? I don't trust identities, and I think they make us dependent. When I go into schools to give talks, I've heard from a number of young people who have opened up to me about that they feel like they might be bisexual, but they also might be gay, or they might be straight, or whatever the case may be, and they can't really figure themselves out. And this is always a source of angst. And what should I call myself? What am I? What can I tell my parents I am? Or I'll hear from parents saying, I don't know what my child is. My child hasn't explained it to me clearly yet. I need to know what my child is. Well, I always just tell them, I say to the young person, it doesn't matter. One day you'll fall in love, and that's what will matter. What is the biggest misconception that people may have? I think that one of the biggest misconceptions that people may have is that male and female are separate, but they exist on the single same spectrum, and they meet in the middle, and there's plenty of overlap in between. And not just in people's gender identities. Some people feel like they're exclusively male, some people feel like they're exclusively female, and some people feel like they're right in between, both male and female, or neither male and female. But it's also in our biology, in our bodies, the intersex condition. People are not born either male or female to begin with. That's a common misconception. There are all kinds of conditions, intersex conditions, in which a person can find themselves at birth neither exclusively male nor exclusively female. In all things there's variation. And And for me, where I place myself on the gender spectrum is on the male side of middle. There was a documentary made about me by that name, on the male side of middle. That's where I identify. There is still femininity in me, and I don't suppress it or ignore it or hate it. I actually value it, but it doesn't make me feel like a woman. I'm on the male side of middle. Are there any experiences or stories that you would like to share, good or bad? Let's see, experiences or stories that I'd like to share. I don't know, thinking back to my transition, which was good eight or so years ago, probably one of the hardest parts of my transition was trying to get my mother-in-law to switch pronouns with me. Not because she didn't want to. She wasn't stuck on she because she didn't accept me as a guy. She fully accepted me as a guy. In fact, she claims that she knew it first, and she was off telling her friends long before I transitioned that Sharon's girlfriend, I swear this is a man in a woman's body, and I'm just waiting for her to tell me that. So it wasn't a matter of acceptance, but she could not get her mind around switching a pronoun. I'm convinced that pronouns come out of a completely different area of the brain than something like, say, a name, something that's remembered. Pronouns, it's like it's pre-programmed somewhere in the limbic system, in the ancient region of our brain that just acts on instinct. And if you've trained your brain to use she with somebody, it's really, really hard to switch that for some people, for many people, for most people. But some people have a harder time retraining their brain than others, and my mother-in-law was certainly one of them. So we had to come up with a way to retrain her brain, and we came up with the Calvin jar. So anytime she would call me Caitlin or she had to put 25 cents in the Calvin jar. And I swear on one visit I made almost $10. One bad experience, I suppose, that stands out. I've been very much supported by my family, loved throughout all of this, even though it was a struggle for them to come to understand and accept. But they went through that struggle lovingly and respectfully and have come through on the other side celebrating who I am. But there was one occasion where I met an extended family member who had not spoken to me since the transition. And so this was many years later, and she said to me, she sat down and said to me that in order to have a relationship with me, she had to think of Caitlin as dead and to meet me as somebody different, somebody new. And it was spoken, I think it was her way of accepting me and expressing her acceptance. But I don't think she heard what she was actually saying. That she had to think of me as dead. And that the person before her was somebody else. Well, I told her, well, as long as you love me. Simple as that. But is there a question that I haven't asked that would be helpful for healthcare students to understand? I don't really envy being a healthcare provider in the area of trans healthcare. Sounds weird to say it, but the thing about being trans is that it can take time to come to understand oneself. And then it can take time to learn how to communicate that to others, and to have the courage to communicate that to others. So often it's a very gradual, reluctant process to begin speaking the truth and communicating the truth. And so I would encourage healthcare providers to be patient and to be open, and that sometimes our stories will unfold slowly, gradually. Sometimes maybe we'll even make statements that contradict something we've said earlier. I mean, I know that I was asked a number of times before coming out as gay, as lesbian. I was asked directly if I was by a number of people, and I would always say, no, 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 no. Why would you ask such a thing? No. I'm not attracted to women. Right? And it's protecting something that I don't want somebody else to know. And in terms of gender, I remember one day when I was a young teenager, my granddad asked me if I had a secret desire to be a boy. And I felt invaded, vulnerable, angry. And I shut him out, and I lied. I said, no, no. And I shut him out for years afterwards. I didn't want to be seen by somebody who saw me. So the important thing with trans people is to remember that the truth comes gradually. And it's just about openness and creating that safe space. Also, I really want healthcare students to understand just how much of a scramble and a mess the healthcare system is right now for trans people. People don't know how to navigate it. They don't know where to begin. They don't know where to go. They don't know where to turn. And even healthcare practitioners can't tell them most of the time. So we need you to sort this out for us. We need you to make it better for us. Because it's just about making things better. It's about quality of life. And it's about every human being's right to health and happiness.